Fellow Kenyans, you understand that President William Ruto has been obsessed of changing things from this to that. We changed from NHIF to SHA. We changed from health to education funding model. And you can go on and on, things change. But the more they change, the worse they get. Not even that they remain the same, they get worse. Now, let's go to SHA and NHIF. The main reason why we moved from NHIF to SHA was because we are being told that NHIF was full of cartels. And the cartels were diverting resources and taking away resources from reaching the facilities, from giving Kenyan services. And that's the main reason why we moved from NHIF to SHA. Now what we are finding is that there was just about replacing the cartels of NHIF now with the cartels of SHA. And that's why you're finding now very many facilities are being given money from SHA and they don't exist. Some of them are in a bush that even has no road, yet they have treated over 10,000 patients, and you see 2 billion, 3 billion have reached there. The government is even giving SHA money to private insurances, and something we don't understand whether this money was supposed to be channeled to insurances like Jubilee, or actually this money was supposed to go to healthcare. So you have to realize that this government has no intention to do what needs to be done. Corruption is the order of the day. And everybody is accusing everybody. That is the executive accusing parliament, parliament accusing the executive together with the parliament is accusing the judiciary, and the judiciary is just doing one thing: stop all the things which are violating the constitution, ladies and gentlemen. So what I want to say as a way forward, the question is, why should a government wire money to a facility instead of just doing the simple thing? Ensure there are drugs in hospital which can be purchased. They have KEPSA, they have KEMSA, they have meds, they have people who can procure this medicine and supply them to hospital directly. Secondly, government have doctors on their payroll. Thirdly, equipment can be bought and this hospital should be equipped. That's it. When I did my studies in Spain, which is a welfare state, Taifa la Ustawi, they believe that so long as you are a citizen with your ID, you walk to a hospital, drugs are there, doctors are there, equipment are there, and you walk out. There is nothing of creating middlemen. Creating more middlemen creates more people who are taking cuts after cuts. So you find that a Panadol, which should be 20 cents at the manufacturer's shop, is being sold to you at 50 shillings, 20 shillings. How much people are eating on the way there, only the government knows. Can you imagine? Out of the 56 million Kenyans, everyone has some Panadol somewhere in their drawer. So let's say you have 10 Panadols in your drawer. So 10 times 56 million, that is actually 560 million. Now, if at all you have 10 Panadols, we are talking about 5.6 billion. Now, if you see the cut they make per that, if they are making 2 shillings per that, then actually these people are making trillions of money from Kenyans. Let me tell you, Kenyans, this government has shown they have no interest, they have no will, they have no capacity, they have no team to solve the problem that are bewildering Kenyans. What they are thinking about is how to make themselves rich and richer. And I can tell you very well, if there's a need for it, let's review this system as I've said. Take the services to the hospital directly and avoid the middlemen and the middlewomen from taking money from Kenyans. Because it was there before, it is still there, it will continue there. And as I said it, Kenyans, we have to understand the value of the cost of electing a good leader. It needs sacrifice and perseverances. If we cannot be able to pay that cost, then we have to pay the price of bad leadership. So the choice is yours. Are you going to pay the cost of good leadership, or you are going to pay the price or bad leadership. And that is only yours on 10th of August, that you want to decide that you want to choose which government that can take care of you for 5 years if you sacrifice for one day. But should you get fed on that one day by bribes, in terms of being bribed by the people they call themselves leaders, you will stay fed up with that government for another 5 years. Thank you, God bless you, and God bless Kenya.